Let me also specially appreciate one of our special guests, the Honorable Commissioner of Health for Ogun State, Dr. Babatunde Ipaye. You're welcome, sir. Today we will be unveiling the NMA 2017-2021 strategic plan in a bit. It will open up areas of focus, partnership with government and strategic stakeholders on how we can best improve health indices in the country. But all of that will be after the speech by our special guest of honor. So distinguished guests, ladies and gentlemen, to take this to the next level, well, we also have with us the Honorable Commissioner for Health for Taraba State. Thank you very much, sir, for joining us today. And the Director General for NACA, the National Agency for the Control of AIDS, Dr. Sani Aliyu, is also with us. Thank you, sir. To Your Excellencies, distinguished guests, ladies and gentlemen, for our speech about now and the unveiling, which will follow immediately after that, His Excellency Professor Yemi Osinbajo, GCON, Senior Advocate of Nigeria, and Vice President of the Federal Republic of Nigeria.
We're listening now to a speech by the Vice President, His Excellency Professor Yemi Osinbajo, GCON, SAN.
The chairman of the occasion and former president of Nigeria, General Yakubu Gowon, GCFR, the president of the Senate, Senator Dr. Bukola Saraki, members of the National Assembly here present, especially the chairman of the Health Committee of the Senate, Dr. Lanre Tejosho, the Honorable Minister of Health, Professor Isaac Folorunso Adewale, other ministers present, Permanent Secretary, FCT, representing the Minister of the FCT, heads of federal government agencies and parastatals, the President of the Nigerian Medical Association, Dr. Mike Ogirima, Chairman of the Nigerian Medical Association, FCT, Dr. Chidozie Jude Achonwa, former Minister of Health and keynote speaker today, Professor Itai Olambo, members of the Nigerian Medical Association here present, distinguished guests, ladies and gentlemen. First, let me say how excited I am to hear from the Senate President himself that we will be getting the 1% for the 1% of budget for healthcare this year. This, I think, is wonderful news. And not only should we all be excited, I think we might all even go home right away, knowing that practically all our prayers have been answered. So I look forward. So we look forward to this budget, and I'm sure that in the next couple of days we will see it. Mr. Chairman, aside from lawyers, doctors are the next most important professionals. And why is that? As one rather rude fellow said, it is lawyers who usually cause people's medical problems. And of course, doctors benefit from treating them. Mr. President, that is, when I say Mr. President, I mean Mr. President of the Federal Republic and not Mr. also recognizes the place of lawyers. And that is why he appointed 7 lawyers into the federal cabinet. We are closely followed by doctors. 4 of them are in the cabinet. But you know, doctors, and I think this is to be expected, have a never say die approach to life. So when we thought we had won, we suddenly found a doctor sitting in the position of the president of the lawmakers. By that I mean, of course, the distinguished Senate President, Dr. Bukola Saraki. But we are comforted by the fact that he is now more a legal personality than a doctor. I trust that none of us will take our medical problems to him. It is a special privilege and pleasure to be here at the 58th Annual Delegates Meeting and Scientific Conference of the Nigeria Medical Association, the NMA. I'm here to represent President Muhammadu Buhari, and I bring his warm felicitations and best wishes for a very successful conference to you all. The theme of this year's conference, Quality Healthcare, an indicator of good governance, could not be more apt for these times. There has been, and I'm sure that we all appreciate this, a considerable amount of attention being paid in recent months, especially to the importance of human capital development in Nigeria. And at the heart of this, of course, is to be found healthcare and education. A few weeks ago, we had a special expanded session of the National Economic Council, which I'm privileged to chair, on human capital development. It was an opportunity for frank and detailed conversations by governments, civil society groups, and philanthropists, especially around healthcare and education. But two crucial takeaways from that meeting, at least for me, are first, is that while public sector investment in healthcare must be substantially improved, it is unlikely that it would ever be sufficient. In other words, paying for healthcare from budgets will not be enough to move the needle in healthcare funding. A robust national health insurance scheme will be required alongside private sector and donor partnership funding in order to truly move the needle in healthcare funding in Nigeria. The second is that these necessary investments and sacrifices in our healthcare system must be made in a timely manner and to demonstrate the patience and steadfastness required for the long-term planning and investment associated with enduring healthcare reform. These two takeaways, I think, are crucial from our extended meeting on human development in Nigeria. But it's no longer news that we inherited a troubled healthcare sector and that the healthcare sector has been troubled for a long time. As one of the manifestations of the severely low spending on infrastructure generally, and healthcare in particular, I think that what we've seen through the years is a scandalously low level of funding for public healthcare, for public health in Nigeria, and especially healthcare in particular. The levels of public sector investment in healthcare in our recent past has in no way reflected our earnings, well, high oil earnings, especially in the periods between, say, 2010 and 2015. That was when we earned the highest in oil prices, we had the highest in oil prices. And to this, a devastating insurgency in the Northeast, which succeeded in bringing an already tottering healthcare system in that part of the country to its knees, with the attendant impact on immunization levels and the availability of medical personnel. There were some issues that consumed a substantial part of our attention, and these issues were amongst them. The problems with the healthcare sector, the problems of poor funding, and of course, the problems in the Northeast and the threats of the spread of diseases, some of those diseases that had been under control, on account of the fact that it was extremely difficult to reach many parts of the Northeast until a couple of years ago. I'm pleased to note that we have since stabilized this dire situation. Our short-term special intervention program and the medium-term economic recovery and growth plan have helped set the economy solidly on the path of recovery and growth. The insurgency in the Northeast has abated considerably, and just this week, for the first time, Borno State celebrated its first public May Day in Maiduguri in the past 5 years. Having identified healthcare reform as one of the major drivers of our nation's economy, and under the able leadership of the Honourable Minister of Health, Professor Isaac Adewale, our administration has prioritized basic healthcare delivery services for Nigerians through the revitalization of primary healthcare, and we have retooled the National Primary Healthcare Development Agency for better performance. President Buhari personally launched a pilot of this revitalization program at the Primary Healthcare Center in Kuchigoro village here in the FCT last year. And also in line with this, in 2016, we disbursed $1.5 million to each of Nigeria's 36 states and to the FCT to support them in strengthening their primary healthcare system as part of our Saving 1 Million Lives Performance for Results program. Another round of funding will surely be disbursed to performing states based on the results from an assessment of the impact of the first round of funding. Just last month, we launched, in the presence of the Director General of the WHO, the Basic Healthcare Provision Fund. The implementation of this fund will commence soon, and we expect this to be done in the 3 pilot states, Abia, Niger, and Osun states, with plans to scale up within the next year. In terms of public health, the proactive and commendable effort of the Federal Ministry of Health through the Nigeria Center for Disease Control, NCDC, in coordination with the national response to recent outbreaks of diseases, especially infectious diseases like Lassa fever, cholera, acute water, diarrhea, and cerebrospinal meningitis, is worthy of note. We expect that the passage of the NCDC Establishment Bill by the National Assembly will further strengthen the agency and provide smoother environment for their operations. Through the National Primary Healthcare Development Agency, we have launched an aggressive strategic plan to attain 80% immunization coverage by the year 2020. Because it is clear that we must improve the levels of immunization coverage in Nigeria. We have also, through our National Sovereign Investment Authority, invested $20 million in 3 of our tertiary hospitals, Lagos University Teaching Hospital, Aminu Kano Teaching Hospital, Kano, and the Federal Medical Center in Umuahia, Abia State, to establish world-class cancer treatment and medical diagnostic facilities. We intend to follow these with targeted interventions in the heart and in the treatment of heart and kidney disorders in particular. Again, in line with our overall economic development plans, we're working hard on incentivizing private sector investment in healthcare. Already, the CBN Hospital Intervention Fund has helped fund some hospitals, especially some of those that have shown track records for game-changing activity in healthcare. We believe that the next phase of healthcare development in Nigeria is going to depend a great deal on technology and innovation.